Welcome to my channel. Thanks for visiting. Today I'll be talking about ciprofloxacin. Ciprofloxacin could come under the brand name Cipro, Cipro XR, and Proquin XR. Ciprofloxacin belongs to quinolone antibiotics group. This is a class of antibiotics with a broad spectrum bactericidal activity against gram-negative, anaerobes, and some gram-positive agents. Pretty useful in both human and veterinary medicine. Fluoroquinolones, generally as a broad class, contain a fluorine atom with a bicyclic core structure-related substance 4-quinolone. It could come in various forms, meaning ciprofloxacin could be given intravenously, immediate release by oral, extended release by oral, or oral suspension. The mechanism of action. Generally, all fluoroquinolones are bactericidal. The bactericidal activity is done by inhibiting bacterial DNA synthesis. They will all bind to DNA gyrase and DNA topoisomerase 4, which will lead to DNA cleavage. The cleavage will lead to the death of the bacteria. Pharmacokinetics of all fluoroquinolones, including ciprofloxacin, is essentially that they have very high oral bioavailability. For example, norfloxacin is given by oral only, while ciprofloxacin that I'm talking about today will have bioavailability that is greater than 70% if given by oral. Pharmacokinetics also includes the fact that absorption from upper gastrointestinal tract can be impaired with some agents like milk, Antacids, Zinc, Sucralfate, Magnesium, Aluminium, Calcium, and when you give all these, that will form Cation-Quinolone complex. So don't give these agents with ciprofloxacin. And if you must give any of these agents and ciprofloxacin in one individual, then create a time gap about 3 to 4 hours apart. Also, pharmacokinetics will include that it can accumulate in stools, prostate, bile, lungs, neutrophils, kidneys, and urine. Ciprofloxacin is a big brother antibiotic, just like other fluoroquinolones. For that, we don't use ciprofloxacin for minor cases. For example, someone is having uncomplicated cystitis. Why going for ciprofloxacin? It's not necessary. Or the person just wants an agent for acute bronchitis. You don't need ciprofloxacin. But for severe infections, and we must tell the patient about side effects. Is this patient pregnant? If the answer is yes, then no ciprofloxacin today, please. Is this woman breastfeeding? If the answer is yes, then no ciprofloxacin. Is this a child? And the child is less than 10 years? If the answer is yes, then no ciprofloxacin. You may use ciprofloxacin in children greater than 8 years if you don't have other effective antibiotics available. But you have to use that for the shortest period of time, and these will only be given after explaining the possible side effects to the parents and consent is gained. Adverse reaction. Ciprofloxacin is a good antibiotic, but there are serious side effects and less serious side effects that the patient must be aware of. And we have to tell the patient all this so that they can decide to make use of the same medication or have alternative entirely. Dalafloxacin in the group of all the fluoroquinolones is a newer generation, okay? And we expect it to have less side effects, but we don't know much about that yet. Still on adverse reaction, when it comes to musculoskeletal system, there will be tendinopathy and arthropathy. meaning that the tendons like Achilles tendon can rupture. Okay, of course, any tendon can rupture with ciprofloxacin. So we have to stop the medication if there's joint pain and joint swelling. And we must advise the patient to avoid exertion. Arthropathy with cartilage erosions is pretty possible in children using ciprofloxacin. So the other time when I said children no less than 10 years, no ciprofloxacin, this is one of the major reasons. Cartilage erosions in children on ciprofloxacin. So don't give it to breastfeeding mothers, don't give it to pregnant women, don't give it to children less than 10 years. Still on adverse reaction, seizures. This is pretty rare, but more pronounced when ciprofloxacin is used concomitantly with non-steroidal anti-inflammatory drugs like ibuprofen or theophylline, because there will be augmentation of the displacement of GABA from the GABA receptors. Okay? And there may be pseudotumor cerebral. The possible adverse reactions continue to involve possible blockage of neuromuscular junction. Because of that, anyone diagnosed with myasthenia gravis should not take ciprofloxacin. Anyone already diagnosed with aneurysm or having the risk factors associated with aneurysm should not take ciprofloxacin, because the likelihood of having aortic aneurysm or aortic dissection will be increased while on ciprofloxacin. In patients with mitral valve prolapse, avoid the use of ciprofloxacin. Glucose metabolism. You just need to know, particularly if you are dealing with diabetes mellitus, right, whether the glucose level is increasing or dropping, because it could give both hyperglycemia and hypoglycemia. And of course, it may cause renal detachment. This is not pretty common, but it's worth mentioning. Phototoxicity is likely going to occur with ciprofloxacin. Hypersensitivity that may be immediate, that is an anaphylactic reaction, is not very common, but it's worth mentioning here that may be. So find out if there is hypersensitivity to any of the fluoroquinolones before administering. And then fluoroquinolone-associated disability or persistent multisystem adverse effects can occur with any of the fluoroquinolones, but mostly with the topmost three, where ciprofloxacin has gained recognition. When it comes to the central nervous system, there may be headache, altered sleep pattern, dizziness, changes in mood, delirium, hallucinations, agitation, and cognitive impairment. And also, it may be associated with peripheral neuropathy, which may be for a long-standing time, in some patients, and it can occur at any time during the use of the medication. Actually, in some patients, the peripheral neuropathy may be permanent. Still on adverse reactions, prolonged QT. Ciprofloxacin is not good for anyone who had been diagnosed with prolonged QT syndrome, and it's not good to use ciprofloxacin with other medications that could prolong the QT, like erythromycin, haloperidol, olanzapine, and the list goes on. While that, with prolonged QT, that may lead to tozadipine. Tozadipine may degenerate to ventricular tachycardia that will first of all start with monomorphic ventricular tachycardia, degenerating to polymorphic ventricular tachycardia. And polymorphic ventricular tachycardia can degenerate to ventricular fibrillation. With defibrillation, if there is no defibrillation, that could degenerate to asystole. When there is asystole, If advanced cardiac life support is not instituted on time, with code blue being called, then the patient will end up in the morgue, meaning death. It is also noteworthy to mention hepatotoxicity, okay, that could occur. Although the good news here is that ciprofloxacin will have less hepatotoxicity compared to some of the members of the fluoroquinolones. Gastritis. There will be less of diarrhea, but there will be more of nausea and vomiting, anorexia and abdominal discomfort. And coccidioides or Clostridium difficile infection is possible, and whether ciprofloxacin has broad coverage. So we can have that at the back of our mind that we may run into pseudomembranous colitis. Resistance to fluoroquinolone is growing worldwide. The same with ciprofloxacin, right? So less resistance with H. influenzae, IM culturalis, and strep pneumo. So ciprofloxacin could be used closing your eyes if you are dealing with any of these three agents. Now, drug-drug interaction. Ciprofloxacin is an inhibitor of hepatic cytochrome P450, thereby increasing the availability and toxicity of many other drugs like caffeine, clozapine, zanidine, warfarin, ibrutinib, theophylline. But if we are dealing with the entire fluoroquinolone family, norfloxacin can increase the effect of theophylline. Not saying that Cipro would not do, Cipro can do the same. And also another medication that the concentration can be increased is ropinirole. The list is beyond this, right? Now, drug-drug interaction. Hepatic enzyme inducers like rifampin and rifampicin, also carbamazepine, phenobarbital, sodium valproate, and so can reduce the level of many of the fluoroquinolones, particularly moxifloxacin, but it can do the same to ciprofloxacin. It is better to contact your pharmacist or your clinical pharmacologist when it comes to other medications that could affect the efficacy of ciprofloxacin. Uses of ciprofloxacin. 1. Prevention of spontaneous bacterial peritonitis, mostly in liver pathology, right? Liver cirrhosis. Intravenously 400 mg or per oral 500 mg every 12 hours for 7 days, or per oral 500 mg once daily if you are going to use that prophylactically for a long time. Also in anthrax, in patients already exposed to anthrax, you can give ciprofloxacin intravenously 400 mg every 12 hours for 6 to 9 weeks. Wow, pretty long, right? In infective endocarditis with prostatic valve, intravenously 400 mg or per oral 500 mg every 12 hours for 6 weeks. Or if it is infective endocarditis with native valve, then intravenously 400 mg or per oral 500 mg every 12 hours for 4 weeks. So we'll use for a lesser period of time if it is native valve, then longer time if it is prostatic valve. So 4 weeks compared to 6 weeks in prostatic valve. In osteomyelitis, we'll give these 400 mg intravenously every 8 hours or every 12 hours for more than 6 weeks. If you have chosen the per oral route, 500 or 750 mg every 12 hours for greater than 6 weeks. In gastrointestinal tract problems, you can give per oral 500 mg twice daily for 3 to 5 days, or per oral 750 mg once daily for 3 to 5 days. In cholera, can give it 1 gram, just start. Means 1 gram once. Still on uses of ciprofloxacin in Crohn's disease, you may have to choose ciprofloxacin with metronidazole, and you give that per oral 500 mg twice daily for 4 weeks. In chronic obstructive pulmonary disease with acute exacerbation, you can give ciprofloxacin per oral 500 mg or 750 mg twice daily, and we will use ciprofloxacin for many more conditions like travelers, diarrhea, and so on, even typhoid or paratyphoid. So with that, I've come to the end of this presentation as per ciprofloxacin. It's a pretty good medication, but should be chosen wisely. Thanks for listening. Please check my channel for the full presentation on the class of medications known as fluoroquinolones generally. That has been published right here. And very soon, I'm going to publish another one on delafloxacin, the newest generation of fluoroquinolones. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.